is a personal, private experience. Many people are affected by it. We never quite know what their experience is easily, although it is major anguish and suffering. It can vary from a small irritation to an overwhelming experience where all my consciousness or awareness is filled with the feeling of pain. The question I would really want to ask you, or the dilemma we're working with, is really what can people do to sort of reduce their own pain, and what can health providers do? Or maybe a question even before this is, what underlies pain? Because so often when people have pain, it may affect the way they perceive themselves in the world. Now, what is happening when you get injured and you have pain? How does that change your own self-image, or does it?
I think from the theosophical perspective, where we always think of a man with not only one dimension, the physical dimension of perceiving, we feel very strongly that within each person there is a core at the spiritual level, and we could call that the level of the soul. The word doesn't really make any difference. So that within each person there is a core, we could use another word, of wholeness.
So despite the fact that someone has extreme pain, in a way you're saying it is critical to remember, both for the person themselves who are in pain, that they are more than the pain, that there is a center in them, which is that spiritual component. And at the same time, for the health professional or family members to also remember that process.
Yes, I think it's a very powerful concept. And also, the mind, the perceiving mind, plays an important part beside our feelings, because in pain, one of course has a sensation of destruction, of intolerable sensations. It destroys two things: self-confidence, because one does not really fully realize how long this pain is going to carry on. I'm talking really in terms of more or less chronic pain.
So you're saying in a way that if I get chronic pain, the pain reoccurs, then what it does is starts doubting first that my body will ever get well again. So that sense of knowingness that I can be well is reduced, and it affects in a way my perception of what I can do in all other parts in my world. So it feels like I'm limited.
I think it makes one feel very limited to the only physical sensation of pain which really overwhelms one. And I think if one does not realize that one could have, beside the physical pain, that even how one feels could be somewhat detached from the sensation of physical pain, this is important. I mean, even if one's energies are way down, if one can realize that only part of me is suffering this overwhelming pain, one could continue to feel affection to one's child, for instance.
So you're asking almost the impossible in a way, when I have extreme pain, to somehow to say to myself, the observer of the pain recognizes that I am separate from that pain in a way. And in that process, seeing yourself separate or realizing there is some wholeness in you, that by itself decreases pain? Or change
I think it would bring the pain in a perspective. Instead of being overwhelmed by it, one could say that there is terrible pain, but there is beyond that a sensation that I am still myself.
Okay.
I think one often loses that sense of self and just say unconsciously, I am the pain and nothing more.
And the other part then says, so if I say I am the pain, I also imply I am the pain in the future.
Yes.
So another underlying concept then really would be that I am the pain, or I have this pain for this moment of time.
Yes, I think that's a very important concept.
You know, it's easy to say.
But very hard to do.
Yes, so how can I as a family member now help this with a person when they're in that kind of pain?
I think as a family member it's important for a person to make the person realize that their affection is still going out to the person, which makes a sense of continuity. That because they loved them before, that the love is still continuing. And I think it may bring the first element of hope, because people in extreme pain feel sometimes completely isolated by their suffering.
In a way, that part I don't understand. How, if I suffer, do I feel so isolated? Is it that no one understands me?
You're lost in the sensation of pain.
Okay.
It's a terrible sensation which stirs you up, and you identify so fully with that sensation that one feels isolated from the people around it who do not have that pain.
Now there's another part in terms of the relationships between you, the pain person, and the family, is that as the person is in pain, they also tend to get really exhausted.
Continual exhaustion. And therefore the family person, I think it is foolish to be either too loud in their presence in talking, because I think one's sensation of sound gets exaggerated. I think this is a very common phenomena. And secondly, it is no good saying a lie. You are looking wonderful.
Mm-hmm.
I think the person knows it, that they are not. But say, are you feeling better? And it's so nice to be together with you.
Okay, so in a way what you're doing is you are not in that, when I interact with someone, what I'm not going to do is say, oh, how do you feel? Because that would have the person focus again what they experience in their pain, and it would trigger almost all those associations they have with pain, and all the past memories which aggravate it. Instead, you're focusing it as a pleasure to be in the relationship, that it's you as a human being it's nice to be with.
That's right.
Now there's another part, because as I become, if I have excruciating pain, I also I'm fatigued, exhausted, irritable, and in a sense hypersensitive, not just to the stimuli in terms of loud noises, also to other people's fields around me. Would that be right?
I think that is true. And one has to take that into consideration, and also the degree of fatigue. But I think very strong, I feel, at least personally, very strongly, and I've seen this work, that if the family goes out in an attitude that they are giving energy to that person, he or she will be able to pick up, enhance the person's energy, but also during this relationship, a new relationship develops of caring. And it makes the member of the family feel they're doing something positive.
So in a way, a side effect when someone is in pain is in a way that family members tend to feel helpless and hopeless, that they can't do anything. They almost get irritated in that quality, and that would irritate the patient. So if we can teach in a way, or the person takes that concept, or teach them like therapeutic touch or other strategies where they go outward, then even just sitting with somebody doesn't mean you have to entertain. You can just sit quietly and just think of loving thoughts going through that person. Would that be a way of...
Yes, I think it would. And it would have meaning even if there aren't too many words spoken.
Right. So maybe even just holding the person's hand, not doing anything else, but in a sense sending.
This is, I think, very important for the relationship on both sides, the family, who can feel that they aren't helpless. And I think even if the person cannot respond by words, they have this sense of continuing a relationship, which in my case, I feel very strongly, does in many cases reduce the pain, even for a short while.
There are other parts that help reduce pain. At least it seems if people if they have severe pain, can somehow accept that they have pain without being resigned to it? How do you teach people that quality somehow?
I think an acceptance is important. I think what is not good if there is a great deal of anger in the patient.
So anger and resentment almost aggravate the tension, and that aggravates the pain?
Well, anger focuses and enhances the pain. I mean, it fuels, as it were, the pain, because anger is really a negative energy. But if one could say, at this moment, and I think this phrase, at this moment, I think if one have with pain or difficult relationship, it always, in it, it says, there is a possibility of change. Because I think the possibility of change at all times, whether it's a change in relationship of outlook or direct physical well-being, I think is always an important thing.
So on the line you're saying we as health providers, family members, need to continually imply there is a possibility of change or there is hope. And hope can be a more peaceful dying or a transcendence or a way of a new relationship and sharing with family members or doing a new something new.
Yes, I think that those are the most important attitudes a person can take. It's a difficult one.
Yes,
it's an extremely difficult one.
I mean, I sit here and I say, it's really nice to say, and I can think of remarkable patients. I can think of Pat Norris's little boy who had a brain tumor, who did visualization, and then opened his own hotline for other kids with very severe pain or illness. And in a sense, he was going outward. So there's the other part is almost a sense of altruistic outgoingness of nurturing in pain.
And the thing is, if one is able to do it, maybe one can release a self-healing by doing so, because a patient like this little boy who did it, really by becoming an instrument for healing for others, tunes in to this tremendous healing power which is in the universe. Okay. It is, in other words, not to concentrate on the symptoms, but if possible to tune into that. And I think altruism and trying to help other people is an important factor in this.
So in the giving we receive. Now the question is the area which is even more difficult and for which I think traditionally we have less skills for. What do you do and how can you be with a patient who is dying, almost a terminal patient in extreme pain? What is it I as a family member can do, or I as a health professional can do?
I think the important thing is, if there's a terminal illness, to, within one's own attitude, and therefore unconsciously say, let that person go. Don't hold him back by showing incredible grief. Let him be free, because only from my point of view and from the theosophical point of view, a person is released from the body, but the person goes on. I think that's basic to a theosophical belief, and therefore one can let go. And even if without the belief, it is the power of love is to be willing to have a person set free from pain, isn't it?
So the quest, when people say, look, I don't want you to die, in a sense they are almost making it more difficult for that person. The part which I think in terms of the theosophical perspective or the energetic perspective is so intriguing is that I don't even have to say it in words.
You don't have to say it in words.
So you're really saying, in a sense, that because of that we live in a kind of have an emotional, we have a field around us, that intention has a direct effect. Would you say that?
I think it has a very direct effect. I think in the cases I have observed, and I've observed quite a few cases, it makes all the difference in the family. It's very natural to miss a person. Everybody is human. But the effort to let the person go makes it so much easier for the person who is going to know that there is no anger, no resentment, that everything is done with caring. I think this is the most important part of letting go. And now with regard to pain, I think the other thing is, it is the ability, after all, human beings have one ability, which animals are not supposed to have, that they can observe themselves and judge themselves. Theoretically, no animals can do this. I'm saying this is theoretical, but I think it's accepted very much that that an animal cannot look at himself. And I think in pain, if one can say this other component of myself, I can observe myself having pain, but there is another part of myself which can do the observing, is an important element to develop in a person.
Okay.
Because it makes one aware that there is another element beside the pain.
So almost using the kind of backwards going, saying, I have pain, I can be an observer of pain, and that may be then related to another quality in me. By even accessing that quality, I allow myself a bit to heal.
One accept to heal, and also I think to transcend pain, and maybe even develop other assets which many people feel that they cannot do if they are. There's still a growth possible, in other words. In the process of pain, dying, there is a possibility still of growth, which most people deny.
And so, so growth in the dying process could be dying in dignity and finishing relationships peacefully, getting rid of the angers and resentment. Growth, even, let's say, if I have severe paralyzing pain or have severe pain in my legs, I may offer a support network for others. I can shift.
I think this is a new way. Very few people think of pain and dying, I think, in this way. But I think with the theosophical perspective, in the dying process, we have the pain, we are letting go of what we might call our physical consciousness, but if we realize that the important part in human existence really is the relationships one has developed in a life. And therefore, if people have the time in the dying process, if they can go out, if you have bad relations with your daughter, your son, if you could make the effort, both could make the effort to make a bridge, I think this at the end of one's life is an important asset, to have overcome the angers, the resentment, and to make the effort.
And that quality, that act of doing, of that reaching outward, tends to almost reduce the pain.
It reduces the pain.
Or gives peace of mind.
I think it reduces the pain and brings peace of mind.
Yes, that's a better.
And that, I think, if possible, is an important part, an aspect of the dying process.
No,
and your family has to live afterwards, doesn't it? If this happens, they do not have to have a feeling of guilt either.
Because in a way they have finished. It reminds me in a way, in the extreme form for the family members, of a story you once told of a little boy who died, and the parents then called you up and the mom asked you, Dora, what can we do for him?
That's right.
And that is, in a sense, even once the person is dead, instead of saying, oh, poor me, it's saying, what can I do? Can I send him a sense of packet of love so he can continue in his own form?
That's right. And I think this is the theosophical, that's why we can say this is the theosophical perspective, I think. And I think it makes one have a different view on life and death.
Let me shift for a moment.
Sure.
And the shift is really, we have extreme physical pain, which we already said affects self-image. The other one, which is often common, is very strong emotional pain, that people are almost locked up in the emotional loss.
I think with all pain, there is an emotional, strong emotional component. One is straight fear of the return of the pain. And secondly, even if it's not a terminal illness in any way, I think unconsciously we all during your life, whether you are well or not, one makes an image, one makes two images. One, the ideal image of what the person possibly could achieve in life. Mm-hmm. And the other one, very often a distorted one, that is an extreme feeling of frustration, because what you're actually experiencing is so different from the ideal version, what many people have made up their life should do. I mean, I think there are two images, but the images very often, because that's closer to our astral or emotional feeling, is the feeling of frustration, and therefore what is very difficult to overcome, this sense of self-confidence. Self-confidence is a quality which enables a person to overcome the disabilities.
And we know many examples of unusual people. People have been in concentration camps, and somehow, despite all the horrors, they somehow went out, had confidence to do.
And also Helen Keller.
That's right.
She is always the most famous example of that.
How do you know, but I'm sitting here and I say, yes, I agree. And then I have a person there who's, let's say, 28, and there's a sense of absence of self-confidence. He has the experience in his body, he can't do certain things, he is limited by an activity. What, in fact, how can you now work with that person? What, from your perspective, can you do?
I think, first of all, in a non-verbal communication, I think the non-verbal communication is very often important. That is the sense that somebody cares. Because the growth principle, if a person is paralyzed, has to take within himself in a limited capacity. Mm-hmm. Thus he has to become aware of experiences, even if they are of a limited nature. If, for instance, you hold a person's hand and you think of healing and wholeness, and that person for even 10 minutes can feel that and has a reduction of pain, that person has the first intimation that there is an inner experience. Lots of people never have it in their life. Mm-hmm. Isn't that true?
True.
I mean, people live in their chattering mind so much, and the mind chatters and chatters. But I think one has to learn that there are other dimensions of experiencing, and lots of people don't.
So in a way, the family members, the health provider, the caring person can give that non-verbal, spiritual, emotional support to trigger that. The person and at the same time, the person potentially themselves could also do imagery, visualization techniques by which they can access that more?
I think there are many visualization techniques, and if the health provider could give a visualization technique, and I personally feel there are two, let me say. Everybody has experienced sunlight. And sunlight in all cultures have really practically been a metaphor for both spiritual and physical strength, because it is associated with physical activity as well as very often religious activity. If one could visualize something with regard to the sun and that light, I think it would give one an invigorating experience.
What you're saying in a sense is, even when I'm lying in bed late at night, or when I have pain, or momentarily when I'm sitting at my desk, at that moment, just for a second, maybe just think of like sunlight going through me?
Or that I am in the sunlight. Visualize the sun and be completely
so it almost goes the light goes all the way through and around me.
Just let me be in the sunlight.
Okay.
And the next thing, I think this is much more difficult to do. If you could imagine that you yourself are in the sea, and with the tide going out, the sea is blue, which is finally a soothing color. But the idea of the tide going out, visualize that the pain is going out with the tide. So be in the sea, think of yourself in the sea, and think as a visualize. And that isn't so very hard. Nobody, it has to be always at the simplest levels, but the metaphors must have very simple meaning. I think this might be helpful, because we think of pain as static, and if you could go with the idea. So in a sense, the metaphor of the waves and all this, it's rhythmic, it waxes and wanes, and there are times it will increase and at times there's less, and the soothingness as well allows me to really just be supported and allows me to get more quiet inside. So if I look at let me see, if I look at the perspective, then I say, for work which is unique to the Theosophy, to an energetic perspective, it would be one that we are all fields, and that in fact my emotional, mental fields, even if I don't say anything to the person, already has a direct effect. There is a direct interaction. What about using the word interaction? That's better. And so, in a way, and that is critical because it says that I as a family member, I as a health professional, must somehow be quiet and centered within. Because my own agitation will affect the other person. I think that's one. The second piece is that if I can perceive myself being somehow connected or perceive a higher potential, what also a spiritual potential within me, if I can bring my attention more in that area, then as if the pain becomes a little further away, as if I develop that wholeness in me. And with that idea of the observer, remember you're observing and having a consciousness beyond the physical body by observing that. Okay, so that's two. I think three, it seems we haven't dealt with, that with therapeutic touch or healing, almost direct healing strategy with one's hand, one can often soothe and quiet the field. I think this is very true, because if one has a lot of pain, particularly if it's localized pain, that particular part where there is so much localized pain gets very low in theosophical terminology, in etheric energy. And if we do therapeutic touch, in other words. So that's the procedure which Dolores Krieger has taught thousands of nurses. Or just healing. If energy is restored to that place, it does reduce physical pain, and at the same time, it does bring, I think, a relationship between one's emotions and this etheric, which again makes one for the time being feel calmer and less painful. Finally, if I go back in a summary from the theosophical perspective, or the energetic perspective, is that if I can be more altruistic or outgoing toward others, I can send caring for them. In that process of caring, healing occurs. I think it is. It's at least part of the. It doesn't mean that you may be cured of the disease, but even if a person can go in peace, I think that is a valuable thing. I think this is an important contribution the family can make if the person can go and pass on with this feeling of peacefulness and acceptance, and that the whole family therefore can share that, and not this terrible bereavement which many people really indulge in. I think most theosophists really try very hard for this. I think it's a very typical theosophical idea. The difficulty I find is not with the theosophical idea. The difficulty is when I work with a patient who has either lost somebody, or they have a kind of guilt for losing somebody, or they lost their child or whatever, that they are locked in their bereavement. Well, this is perfectly true, and also there's nothing you can do, because if a person is set in a certain way of thinking, that makes an image And probably time only will alter it, because people get comfort from the image of pain, and they get the comfort that they are doing the right thing, because this is a cultural something sometimes that you have to mourn like that. And if people are in a strong state of mind, you can just send them peaceful things, but nobody can break somebody else's mental picture for them.
So in a way to whatever, because many times pain changes people's mental images, what you're really saying is, at best what I can do is I can send caring and support in order for them to start changing their mental image. There needs to be at least a wedge of openness.
No, I don't think it's that. If a person is absolutely set in this pattern that they have, it's partly expiating a feeling of terrible guilt, which they will never acknowledge in words. Mm-hmm. They have to go through these extreme modes of grief. And there's nothing anybody can do. But if one can say, I understand, you don't have to approve of it. It's only after a little while one can say to such a person, what if you were in the other person's shoes, and if they were alive, would they be happy to see you go through it? But not in the beginning. There is nothing you can do. The stronghold of the image is very powerful. And one can only do the best by giving them support.
So in a core sense, it is the acceptance and the giving and slowly allowing one to go, and that goes both ways, from the patient and from the family members. It's a joint giving to allow.
That's right.
And in that allowing, one finds peace.
That's right.